Hey, what's going on, guys? It's Victor from Cyborg for Life, and today I'm going to flip the script and talk about leg length discrepancy. So most of the content that I put out on this channel is to help publicize the newer, more popular cosmetic limb lengthening surgery to get taller, but I still get questions on leg length discrepancy, and this channel is on leg lengthening surgery, so I'm going to show some love to my discrepancy people out there. Plus, that's the reason why cosmetic limb lengthening surgery exists in the first place, all right? So what is leg length discrepancy? Well, in simple terms, it's when you have one leg that is shorter than the other one, okay? But if the discrepancy or difference between your legs is large enough, it can cause really bad pain in your back, your hips, your knees, your ankles, which is due to total body misalignment, also known as induced scoliosis, okay? So, there's actually two different forms of leg length discrepancy. You have functional and anatomical. In functional, it's when you have, pelvic obliquity, which is tight muscles of the hip, which can actually cause uneven lengths of your legs. But all you need here is just some exercises and manual therapy and you're good to go. But in anatomical or true leg length discrepancy, the bone lengths actually differ between the two legs. And you're going to need a different treatment option here. This could be due to congenital reasons, meaning you were born with it, due to trauma or infection of the growth plates on the shorter side. Your longer leg could have just grown longer, or it could be due to some neural inhibition, meaning like your nerves weren't firing correctly during your growth phases, okay? So how do you fix it? How do you treat leg length discrepancy? Well, after you undergo a thorough physical and x-ray examination from a trained limb lengthening surgeon to figure out if you even have a discrepancy in the first place and by how much, then you have three different options. Option number one is going to be leg shortening, where they go in to the taller side and they can pull out a segment and basically match it up with your shorter side. It's usually not recommended anymore, but it's an option. Then you have option number two, which is going to be induced growth arrest, where they can actually stunt the growth of the taller leg and allow the short leg to catch up. Again, this has to be done at the right age before the growth plates close and you're done growing. And then you have the most popular and recommended option, which is what we talk about on this channel, leg lengthening surgery, where the doctor will actually go in, break the leg, use some sort of lengthening device like an internal nail, lengthen the leg, allow it to heal, you work hard at rehab and you're good to go. Okay, this is the most popular option because of the fact that it helps you maximize height gain over time, all right? Now, most people, believe it or not, have some form of discrepancy between the legs. I think it's like something like a third of the population. It's ridiculous. But a lot of times that discrepancy is so negligible, like usually like a centimeter or less, like a half inch or so, that they don't even notice it. And it's usually not going to require surgery. But if it's like 1.5 to 2 centimeters or more, then you probably are going to want to get checked out because of the fact that they can lead to long-term complications. In fact, the complications that it can lead to can be way worse than the ones that a cosmetic limb lengthening patient will worry about. All right. In fact, the ones that they worry about are the ones that a leg length discrepancy patient deals with on a daily basis for years on end. And if you don't catch it soon enough, a lot of those problems can become permanent. All right. But after you get the surgery done, the relief is almost instantaneous. In fact, I remember for a fact that like when I got it done, yes, I had to get used to the new leg and the biomechanics and everything like that. But I was just like, man, I knew that I was going to feel really good after this. So what about payment? Well, due to the fact that leg length discrepancy is technically a medical necessity, insurance is going to see it that way and help assist and cover some portion of it, all right? It's not always the case. In fact, I know some patients that travel internationally don't have it that way. But for the majority of cases of people who have leg length discrepancies, insurance will help cover it. And that's for good reason, because this is a health problem and it is something that needs to be taken care of. It's not just for the sheer height. It's really actually can cause problems down the line, okay? What about choosing your doctor? Well, I always say that you want to choose a doctor who's well-versed in both limb lengthening and deformity correction because of the fact that, you want to make sure that they can troubleshoot along the way. And a lot of times the bone of the shorter leg is not perfect, okay? A lot of times there's some sort of deformity and you want to make sure that the surgeon can correct the deformity while lengthening your bone. In fact, I know Dr. Rosbrook is very famous for using an internal nail with blocking screws to help correct something like a valgus or knock-knee deformity while lengthening the bone, which is really, really cool. So you want to make sure your surgeon can do stuff like that under their surgical technique and fix you up, okay? All right, like for me, my story, I basically had a leg length discrepancy. I was a kid and I was roller skating. I broke my left tibia, got growth arrest or stunted my growth on my left tibia, but I also had my right femur was overgrown because of a previous injury. So that caused a big discrepancy between my legs. But my wonderful doctor, Dr. Janet Conway from the Rubin Institute for Advanced Orthopedics at Sinai Hospital in Baltimore, Maryland, my hometown, which is going to be coming on for an interview soon, so stay tuned for that. She used the original precise nail to go in and lengthen that tibia. We did all the length on that tibia to balance out my hips, and hey, she made me into the cyborg I am today. But I plead with you, if you feel some sort of like crazy pain in your hips, your knees, and you feel like you have a slight limp or some sort of, you know that you have a deformity of some sort, go into to a leg lengthening surgeon and get checked out, because if you have some sort of discrepancy that's over a certain amount, it can really amount to some problems. Like for me, I was running and jumping and lifting on my discrepancy for years, and I was just causing all kinds of muscle imbalances and scoliosis and joint problems. I might even have arthritis down the line. I don't know, but I can just tell you that it wasn't cool, guys. It wasn't cool. So if you have that, definitely get checked out. And another warning to all my cosmetic lengthening patients out there, if you're lengthening, okay, make sure that at the end of your distraction phase, you get x-rayed and you make sure that those legs are perfectly even or close enough, because you don't want to create a discrepancy or create a problem when you're trying to fix one, all right? When you're just trying to get taller, you don't want to create a discrepancy, because then you gotta fix that later on, okay? So make sure that your doctor checks that out and make sure you're good, because a lot of times people who are, let's say you're doing femur lengthening, bilateral femur lengthening, a lot of times people who are right-handed will lengthen their right thigh perfectly, but when they go to the left thigh, it's just something about it that they don't place the ERC, the lengthening device, on that thigh as, tightly, and it doesn't lengthen the rod perfectly. So that's a little tip there. Yeah, so hey, that's all I have for you guys today. I hope you enjoyed the video. If you did, hit that thumbs up button. Be sure to subscribe. Until next time, this is Victor from Cyborg for Life, signing out.